Hey, I'm Dr. Gardner, and today I wanted to talk about CPR in dogs and cats. So CPR stands for cardiopulmonary resuscitation. Cardio is heart, pulmonary is lungs, resuscitation is to bring your pet back to life. And if your pet is unfortunately in the active process of dying or has other life-threatening emergencies or may have already passed on the way to the vet hospital and you hand your dog or your cat over, the veterinarian or the veterinary technician may ask you, do you want us to perform CPR on your dog or cat? And in that moment where you may be feeling all kinds of things and being very stressed out and upset, it can be very hard to answer a question that you might not feel like you have a lot of information about. So first, what we do when we're performing CPR is we try to open the airway. A lot of times we will put an endotracheal tube in so that we can oxygenate your pet. The other thing we'll do is perform chest compressions, which is just like you see in the movies, though it's different for every animal. And then we will also try to gain intravenous access. So we'll try to place an IV catheter, and then we will administer life-saving drugs. That's usually atropine and epinephrine. So that's what's actually happening when we perform CPR. You will get between 5 and 15 employees that will all come to the rescue of your pet to try and resuscitate them. And that takes a great deal of coordination and effort, and as a result is also typically quite costly. Around the first 15 minutes of performing CPR on your animal, that can be in the neighborhood of $300 to $500. Survival rates for dogs that underwent CPR, in most studies, survival rate to discharge was in the neighborhood of 4 to 8%. So only 4 to 8% of dogs who have CPR performed on them make it to the point where they get to go home. And in cats, it's even lower. It's really around 3%. So that's something to really take into consideration. Now, you could be one of the lucky pets or the lucky animals, the lucky owner who has the pet, who survives to hospitalization and goes on to live a long and happy life. There's a lot of other factors at play: the cost, the age of your pet, what the underlying disease condition is, what their current medical conditions are. And so this information is so that you can take all of that into consideration to make the best choice for your family. I'm including links to a couple of studies and also to something called the Recover Initiative, which is an organization that outlines how we as veterinarians perform CPR. So I welcome any questions or comments. I would love to hear from you. I hope you will like and subscribe, and I will see you next time.